Thank you, Brent, and thanks to all your colleagues and riders. Those of you who have joined us once or many times before know that we intentionally start each morning with a story from a local individual living with prostate cancer. And we do this to ground ourselves in the reason why we're here, to provide support and hope. And this year, I want to welcome and invite Kelvin and Judy Jones to come to the podium and share some of their story with you. Kelvin is a retired IT manager from Print West, and Judy is a nursing educator at Saskatchewan Polytechnic. They have 4 children, 7 grandchildren between them, and both Kelvin and Judy have called Saskatchewan home all their lives. So would you please welcome Kelvin and Judy.
Good afternoon. I'm Kelvin, she's Judy. In November of 2017, Judy and I were looking at my electronic health record, which was kind of new, and we were looking at one of the lab results from June. And we noticed that my PSA was over 5, and the high for normal is 4. I saw my doc again and got another test, and my PSA had risen again. He told me this was concerning, but it doesn't show really anything. And the only way to find out is to have, if there's prostate cancer, is to have a biopsy. So he recommended us to the urology center at St. Paul's Hospital, where we met Nicole. And she explained the choices we had, which is watchfully wait or have a biopsy. A biopsy was set up for January 25th, 2018. On January 30th, I got a call from Nicole, and she said, "Can you and Judy come in? We'd like to talk to you about the results." And I went, "Really? Uh-oh, that's really quick. They told me a week to 10 days. This is only 5 days, and 2 of those were a weekend. This is not going to be good news." Plans were changed, and Judy and I went in to see Nicole. She explained that the biopsy showed that the right side of my prostate had cancer in all 6 samples. And my Gleason score for those samples were 7, 9, and 9. That's high risk. So the rest of the meeting, with Nicole explaining the option before us, was a blur. I was stunned. What hit me very hard was, how do I tell our children that I have cancer? What should have been an easy thing was going to be very hard. You see, 4 months to the day before, our 17-month-old granddaughter, Lennon, had been diagnosed with leukemia. Judy was working full-time and supporting our daughter's family with a toddler who was going through intense cancer treatments. And here I was, adding to the family stress of having cancer. So, forced with the options of surgical removal or ADT and external beam radiation, we chose androgen deprivation therapy and external beam radiation. In March 2018, I started my ADT regime. And I had all the menopausal side effects that they tell you about, hot flashes and all. And we made this choice based on 3 things that were important to me. The chance, again, of having intimacy with Judy after treatment without using needles, suction, or some other contraption. I could not see myself wanting to deal with incontinence. And I highly respect every prostate cancer survivor here who has chosen surgery and how you've dealt with your incontinence. As I look back on it now, the third thing was that I believe that the right decision was made because I could do it myself. I made it to every radiation treatment on my own. I was able to continue to work, and with the encouragement of a prostate cancer survivor, continued to run. Thanks, Dave, for being here. We had planned to visit Ireland that summer, but radiation was set to start then, so we chose a different adventure, Sedona, Arizona in April, to strengthen us before the treatment got underway. Highlight of that trip was the Grand Canyon. I did 39 external beam radiation treatments in July and August of 2018. Radiation over time added to the fatigue that the ADT was already helping me with. One memory I have during my treatments was that after my 23rd treatment, one of the radiation technologists said, okay, for the next 16, we're going to concentrate on your prostate. And I went, what? What were the last 23 for? He says, well, we were trying to make sure there was nothing else in the pelvic area that lived that was cancerous. Every treatment has its pros and cons. The pros for me was that the intimacy was achieved once off the ADT and testosterone levels were back to normal. This took about 2 years after my treatments, and my PSA to this day is still undetectable. During the ADT, or the cons were, during the ADT regime, I dealt with high levels of anxiety and depression. I went on a medication for this. It was Effexor, and it took over 6 months to get off that medication once my testosterone levels were back to normal. The second con was the radiation burns on my colon, or collateral damage, and caused blood in my urine, or my stool, sorry, and real urgency to empty the colon. And that's difficult at times, especially if you're a runner. I've had 2 colonoscopies to investigate and treat this, and that's some of the other collateral issues. But here's Judy's perspective.
So it's not going to be just the facts. A month ago, when I read Kelvin's first draft, I was struck by the lack of detail and emotion in his writing. And here, I'll insert an apology in advance for some cheesy retro pop culture references. I joked with him, it's as if Joe Friday from Dragnet is directing the interview. Just the facts, sir, just the facts. And I said, I think the crowd wants more than facts. So thanks to me, we have more than facts this morning. They want the lived experience, I said. So the minimal first draft was no doubt partly due to Kelvin's experience being interwoven and at times overshadowed by little Lennon's story. As Kelvin mentioned, his diagnosis came 4 months after Lennon's, and his treatment ended 3 months earlier. It's been an emotional time to relive that part of our lives. But we both took strength from our faith in God, and Kelvin soldiered through and beyond his treatment, as loving fathers, husbands, and grandpas do. And I think it's really a gift to be invited to tell his story today. It's prompted a look back, which has been therapeutic in its own way. And in this process, we give glory to God for the healing that's come through the wise and caring medical professionals, some of whom are in the room today. The most difficult part of Kelvin's experience for me personally was to see the changes to his personality and vitality as testosterone left his body. Mr. T had left the building, and it turns out we are our hormones, and our hormones are us. I pity the fool that doesn't understand that women aren't the only ones that are hormonal creatures. The Canadian Cancer website features patient stories, and Jack's experience with ADT was very true to Kelvin's. And Jack says, I didn't feel or look like myself anymore. I wasn't prepared for the weight gain, loss of muscle mass, fatigue, hot flashes, and deep depression. The physical and emotional toll was really tough on me. It may have changed since 2018, but for Kelvin, ADT, aka chemical castration, involved 6 injections every 3 months for 18 months, plus another 6 months for the effects to wear off. We had read the essential guide, and we knew that the effects would be temporary. But reading about it and living it are 2 different things. The good news is Mr. T returned in mid-2020, and God bless him, he brought Kelvin with him. More good news, our granddaughter is cancer-free and living her best life, and we've welcomed 2 more grandchildren, 2 little boys, now 5 years old. More good news. We've traveled, and we're planning more travel. If not for COVID, we likely would have snuck in another couple of trips.
This is our experience. Every cancer survivor has their own story. The journey was challenging, but we were able to get through the difficult times thanks to our family, our faith community, and the prayers of many people. Life is mostly back to normal now. I'd like to thank the Prostate Cancer Symposium organizing committee for the invitation to share this story. As well, thank you to Murray Hill and the Saskatoon Prostate Cancer Support Group for almost 8 years of support. It is an honor to have been invited to share our experience, and we genuinely hope that our story is informative and encouraging. Maybe lacks a little of emotion and a few details, but we only have so much time. There's so much life and hope beyond prostate cancer thanks to early detection and ongoing research. Thanks, Ride for Dads, and all the other people that do support that. So thank you for listening, and go Riders!